What does a PET scan reveal about bone cancer metabolism? Imagine a tool that can see beyond the bone's surface and tell us how active the cells are inside. That's what a PET scan does. It's a special imaging test that shows how cells in the bone are using energy. Unlike X-rays or CT scans that show the shape and structure, PET scans focus on function. They use a tiny amount of a radioactive substance called fluorodeoxyglucose, or FDG, which is similar to glucose, the sugar our cells use for energy. Cancer cells tend to consume more glucose than normal cells because they are growing and dividing rapidly. When a PET scan is performed, the FDG travels through the body and accumulates in areas where cells are very active. If there is a bone tumor, especially a cancerous one, it will usually show up as a bright spot because those cancer cells are gobbling up a lot of the tracer. This makes PET scans particularly useful in detecting bone cancer early, even before symptoms appear or other imaging tests can see the problem. Normal bone tissue has relatively low metabolic activity, so it doesn't take up much FDG. But cancerous bone lesions, especially those that are aggressive or spreading, show high uptake of the tracer. This difference in glucose consumption creates a metabolic signature that the PET scan can visualize. It helps doctors see exactly where the tumor is located, how big it is, and whether it has spread to other parts of the skeleton or organs. This is especially important because bone cancer can sometimes be tricky to diagnose with just physical exams or standard imaging. PET scans can distinguish between benign bone issues, like cysts or inflammation, which usually have lower metabolic activity, and malignant tumors that show higher activity. In addition to detecting the primary tumor, PET scans are valuable for staging the cancer. They can reveal if the disease has spread beyond the original site, which is critical for planning treatment. When combined with computed tomography and a PET CT scan, it provides detailed images that show both the structure and function of bones and tissues. This comprehensive view helps doctors decide the best approach for treatment and monitor how well the therapy is working. If the tumor responds to treatment, its metabolic activity decreases, which can be seen as a reduction in FDG uptake. Conversely, if the activity remains high or increases, it might suggest that the cancer is not responding as hoped. Overall, PET scans give a window into the metabolic behavior of bone cancer cells. They reveal how aggressively the tumor is growing and whether it is spreading. This information is crucial for accurate diagnosis, staging, and assessing treatment response. It's a powerful tool that complements other imaging methods and helps ensure patients receive the most appropriate care. Remember, always consult healthcare professionals for personalized advice and diagnosis.